Hello everyone, welcome to my channel. Today's topic is current trends and issues in nursing. This is about all the current trends and issues that are occurring in nursing profession and nursing practice. We will discuss them one by one. First trend is nursing shortage. Shortage is having less resources than required. So there has been a shortage in nursing service and manpowers. uh, there is an explanation in before 2000 there used to be many nurses who got trained and worked at the same institute. There used to be institute related to hospital who used to conduct training for nurses, and they used to employ that same nurses in their hospital. That's why the number of staffs were adequate and the number of trainees were also adequate. But there are more number of colleges related to nursing now, and there are also increasing hospitals and work opportunities, but the number has been slightly disbalanced now because of more number of colleges and less opportunities according to the number of colleges and number of seats in each college. There is a nursing shortage. There is nursing, there has been, since few years, there has been a nursing shortage. Although there are numerous educational institutions of various level of nursing education like diploma, bachelor, masters, MPhil, and doctorate, there are also training institutes separately who only train and educate nurses and prepare them for work. But still, number of nurses for service has been found less than required. So there is a nursing shortage. For nursing shortage, you can add this same example. You can add example of staffing. Back in 2000 or before 2000, staffing was done in a particular way. The hospital used to have their own nursing college and they used to employ the same nurses for their as their staffs. But now there are there are disbalanced number of colleges and number of workplaces. Also, there are nurses who wants to go abroad for other opportunities, for a better opportunities. So there is a nursing shortage that has occurred. Next trend is evidence-based practice. Evidence-based practice means practicing with evidence, practicing in a way which is proved by an evidence. Evidence-based practice is applied to solve problems and fulfill knowledge gaps in nursing. So, wherever there is a problem while working, at that time, evidence-based practice can be helpful. To establish evidence-based practice, that can be a good example for this. You can give an example of a research on steps of hand washing. We had previously 5 steps of hand washing, 7 steps, 8 steps. Now they have been developed into 10, 12 steps of hand washing. Why is that changed? Same hand washing. Why is it updated time to time? It is updated to have a evidence-based practice. It is updated because the main technique behind that hand washing is friction of that technique. So in order to become free of all the microorganisms through hand washing, there are updated and developed methods of hand washing, which is developed through evidence-based practice. This is a very simple example, hand washing. This can be applied for any year, first to fourth, but you can add more example like practice of menstrual hygiene, like practice of early breastfeeding, which was not in practice before some years. But nowadays, breastfeeding should be started within 1 hour of the birth because the colostrum needs immunity and protein, which is very important for the newborn baby. You can add any kind of example. And the evidence-based practice, how nurses come to know about evidence-based practice? Because the research which proves evidence, which gives that evidence, is published somewhere. From that published source, nurses can get knowledge and apply that knowledge in their practice. Next is community-based nursing. It is another trend. This trend explain about nursing care, which is not only limited to hospital bed, but it can extend up to individual and family. Community-based nurse who works for PHC, nurse who goes for home visit, can know the people better individually, because community nurse goes for home visit, goes for various programs, creates awareness on the people. So in community-based nursing, nurse can contribute in immunization, family planning, health education, screening of risk group, that can prevent so many disease occurrence. Screening of risk group especially can prevent many medical, surgical, as well as mental health disorders. So community nursing has been developed now since a decade, and it has been proved effective for rural as well as urban areas. Decreased length of hospital stay. This is another trend. Why decreased length of hospital stay is a trend? Because since many years, researchers have shown that prolonged stay in the hospital can result in nosocomial infection, that is hospital-acquired infection, cross-infection, infection from health personnel, and chronicity of some signs and symptoms. Some minor signs and symptoms can become chronic if there is prolonged stay of hospital. So, decreased length of hospital stay becomes a trend for nurses so that patients can get better care at home. Some patient can follow up, like patient of chemotherapy, patient of physiotherapy can come back for follow up, but they should not stay for a long time in the hospital. Better, nurses provide them health teaching of how to stay safe at home, how to maintain hygiene, when to take medicine, and patient gets care in their home itself. Aging population. This trend is related to people of age above 50. So, aging population needs special care because of their body physiology. Aging population, their body go through degeneration of tissues. So, their metabolism has become slow, their heart function, their muscular function has become slow. That's why they need extra care. Aging population needs extra care. Nowadays, in each hospital, there is a separate ward for them, for only aging population, geriatric population, which is an accessible place so that every aging patient can receive the care according to their need, no matter what their disease is, medical or surgical condition, they are kept in the same ward and they are providing care on the basis of need of their age. So this is one of the most important fruitful trend of nursing. Next is increase in chronic health condition. This is a concern for not only nurses but every health professional nowadays due to change in lifestyle, change in dietary pattern, and lack of exercise. There is an increase in chronic health condition and also increase in non-communicable disease. And let me tell you, acute health condition, acute disease, and communicable disease might need a short span treatment, but chronic health condition and non-communicable disease generally needs a long span treatment. Disease like diabetes, hypertension can be prevented, but it is aggravated because of the dietary pattern, lifestyle, lack of exercise. So it is important for nurses to make people aware that they can be sufferer of chronic health condition. So they should maintain their lifestyle, they should change their dietary pattern, they should avoid the food which is processed. Rather, they should eat something which is organic, which is plant-based. Most of the diet should be plant-based so that body can get a better diet, body can produce better products. Along with diet, exercise is also important because muscular movement releases healthy hormones in the body. Muscular movement maintains the tone of the muscles and also improves blood circulation. So increase in chronic health condition is a trend in nursing. Independent nursing practice. These have been talked about. This topic has been discussed about since a long time, and finally it has become a trend in nursing. Independent nursing practice means practicing independently as a health professional. There is a medical team working together that has nurses, doctors, paramedics, pharmacists, lab technician. But still, nursing is an independent profession. We have our own way of caring. We have our own way of providing everything, every care. We make our own diagnosis and implement on the basis of that diagnosis. Nursing care is always independent. Yes, we work in a team, but we have our own independent way of providing care to the people. So, nurse should be able to provide care easily at the ratio of 1:4 in the ward and 1:2 in the ICU. So, if nurse is able to manage her time to practice in that ratio, this kind of practice can enhance our profession. Thus, this is a trend of nursing. Independent nursing practice is a trend of nursing. Next is culturally competent care. Culture means practice, habits that we all have within us. And culture related to nursing means knowledge, practice, and attitude that we all have within us, which is shown in our behavior every day. So, how we provide care, how we communicate with the patient, how we explain to them, this reflects our culture, our nursing culture. We belong to a huge community globally, and we have our own way of practicing according to geographical area, according to college, according to many things. Mostly according to geographical area. A nurses belonging to a geographical area has their own culture of providing care. Some nurses use non-medical practices, focus on non-medical practices to provide care, whereas some nurses focus on medical technique to provide care. However, we try to become culturally competent. We try to promote our culture related to nursing so that we can be culturally competent in providing care. As a result, who benefits from this is public. Public benefits from this because the more nurses provide competent care, the more best health services can be provided to the public. Thank you so much. Next note will be continued in next video.